Welcome to the Capacity Tracker Masterclass webinar for System Champions in local authorities and CCGs. So this session is specifically for System Champions to help you work with the reporting features and functionality in Capacity Tracker. Just before we do some quick introductions, I just wanted to pick up a couple of items. Firstly, Market Insight Tool and Capacity Tracker. So I'm sure most of you are aware in London we have two tools running simultaneously. I just wanted to emphasise that the national guidance is clear. We are in a level 4 incident, therefore all care homes, community health and hospice providers are all required to input their bed vacancies and business continuity information into Capacity Tracker on a daily basis. In London, we are working on a solution to set up an automatic feed from Capacity Tracker into Market Insight Tool, so that care home providers only need to input once into one tool, but we can't give any timelines as yet to when this will be ready. I am aware, and so is the London region aware, of there is some confusion in some parts of London around which tool to use. I just wanted to clarify before we started on the webinar that in line with the government guidance, all providers, care home providers specifically, need to be inputting into Capacity Tracker regardless of what other tool is in place in the region that you're in. The second thing I just wanted to pick up before we start was this session's focused on how to use Capacity Tracker and how to get the most out of the tool and the reports to use within your organisation. If you have any queries regarding the national guidance on the Infection Control Fund or any of the any queries regarding to the new questions around outbreaks which went live on Capacity Tracker about over a week ago, please put them in the chat box and we will get back to you after the session on those, or we will raise with the relevant national teams. So just in terms of, we'll just do some quick introductions. I'm Sanjeet Johal. I work for NHS England and NHS Improvement in London. I'm currently leading on the rollout of Capacity Tracker across the London region. I'm going to let my colleagues Hassan and Chris, who will be running the webinar with me today, introduce themselves very quickly.
Hi everybody, I'm Hassan. I work for Next, who deliver the Capacity Tracker. We're an NHS organisation, and I'm supporting the London region as a relationship manager to embed the Capacity Tracker and work through any issues, working with the regional team and the system champions.
Hi. Go on, Chris.
Oh, thanks, Stuart. Sorry. Hi, I'm Chris Larkin. I work in Sanjeet's team rolling out Capacity Tracker in London. I'm specifically supporting North Central London STP, but I've got other colleagues in our team supporting all the 5 London STBs. Go on, Stuart. Sorry.
It's okay, no problem. Thank you. My name is Stuart Flanagan. I'm one of Hassan's colleagues. I'm covering the Midlands and the Northwest here just to try and offer some support, and thank you as system champions for all your input and support with the Capacity Tracker so far. So if I can add any value anywhere, I've been here from almost the conception of Capacity Tracker, so hopefully I can add value in some form. But over to whoever else is leading. Thank you.
Thanks, Stuart. So just some housekeeping rules, really, just to make sure the 1 hour session flows smoothly. We're going to do our best to make sure that we stick to time and that there's enough time at the end for questions and answers. If you want to contribute or ask questions, please use the Microsoft Teams raised hand button, and then we'll come to you. Chris will be manning the chat box during the hour webinar. After each topic area, we will pause for a couple of minutes to take a couple of questions. If we are unable to get through all the questions during the 1 hour session, we will be collecting them at the end and we will respond to them after the session. Please note that this session is being recorded and we will share the link after. Hassan, over to you.
Brilliant, thank you, Sanjeet. Just before I get started, could I just ask everybody to mute themselves if they're not already, and then put your hand up or a message in the chat box if you have a question, please. Thank you. So to start off with, we're just going to discuss the role of the system champion in each area and the expectations around that. So I'm just going to share my screen. There we go. Hang on. Sorry. Hang on. Get rid of that one. There we go. So this is some draft guidance which some of you may have seen already, but it just discusses what the expectations of a system champion are, and actually what the role is, because there's been some confusion around the reporting aspect of Capacity Tracker, especially. So the system champion was a role that was set up initially when we first started rolling out Capacity Tracker. Once COVID-19 hit and we were Capacity Tracker was the tool of choice. So the role, I've just highlighted some things in grey here for people to read, and I hope you can. I'll just read them out for you. So the first bit is the system champion role is to support those care home, community and hospice providers aligned to their organisation to register and update the Capacity Tracker. And the system champions are local leads who are responsible for the adoption and embedding of the system within their area. So it's quite a specific role. And what we've had across the regions is each CCG and or local authority have allocated 1 or 2 system champions for their local area to liaise directly with care homes. And the other homes that input on Capacity Tracker. What we found recently is we've had a lot more requests, but that's predominantly been because people want access to reporting. So the rules have changed slightly. So the system champions are essentially the people who are proven rejecting care homes when they access the system, and are the leads for the care homes and liaising with the care homes in that area. If you need access to reporting, whether that be the COVID-19 reporting, if you work for public health, for example, or if it's something to do with the vacancy reporting because you work in a local authority, then we can give you access to that reporting suite specifically. We ideally don't want to give reporting access to all people all the time, because actually that data is owned by care homes, not by CCGs and local authorities, and there's a trust element within that, and it's something around information governance as well. So the system champion role is quite specific to usually CCGs and LAs and STPs, and then if you need access to reporting, please get in touch with either myself or your local STP lead so we can get you access to the reporting. So that's the main bit that I need to say around system champions. Does anybody have any more specific questions around that? Chris, anything in the chat box?
Yeah, someone has pointed out that people were told that they had to be system champions to get access for the reporting, which you're right was the case, but now has changed. So I think we'll try and work with STPs and CCGs and local authorities to work out who the best people are and give everyone else reporting access, but not system champion status. Yeah,
that'd be really helpful, because, like I say, the role is quite different. It's somebody that leads, somebody that's approving and rejecting care homes and needs a direct lead. So yeah, I know it has changed, but I think we've realised that there's been a lot more interest in the recent past as it's a kind of big functionality has increased and funding, etc. So just a bit of clarity. So if you do have any queries, if you can go to your STP leads and we can manage that for you.
Cool. And Hassan, people have said, does that mean people can leave the meeting if reporting isn't covered? But we are going to cover reporting. So stick around whether you're someone who's a system champion in the new definition, or you're just interested in how reporting works and what data you can get out of it. This covers everything. So please stick around.
Thanks, Chris. And can I just add, we're going to cover the community health side as well of reporting. It's not just care homes. I mean, a lot of the queries that we get into the region, I'm sure nationally as well, is around care homes, but we will cover some of the reporting for community health.
Yeah. And if there's no more queries, we will move on to reporting, the exciting world of reporting in care homes. I think there might be a hand up.
Yeah.
Yes, it's Angela Woolley from Hillingdon. Do you have a list of who the system champions are in each locality?
Yes, and we can get that for you. Sanjeet, is that something that...
We will do that. We've got your Becky's on the I think Becky's put her hands up as well.
Okay, that's fine.
We'll circulate it by STP after the meeting. Yeah.
Yep. No problem.
Yeah, and it's a very easily run report, so we can get that for you. That's not a problem.
Thanks, Hassan.
Great. So in terms of reporting, we're kind of going to go through a bit of a structured way of reporting, but we're going to start off with the business continuity reports and COVID-19 because they're the newest reports and we know we're going to have the most interest there. Chris, Stu, if I miss anything, please jump in. Hopefully you can see my screen. Oh, I don't think you can actually. No, let me try again. Are we on now?
Yeah, I think, yeah, that's it. Great. Thanks, Hassan.
Perfect. You might see some things on my screen which are different to yours. It's purely because of access rights, but the things that we'll be going through, you should be able to see yourselves. So at the top in the report section, it again looks slightly different this week because there's been some updates in terms of reporting. Oh, and I've been locked out. Try that again. So in reporting, we have in the top tab, we've got business continuity and COVID-19. So we're going to start off on this report. I'll just get onto London. So you will have seen the questions that providers are expected to complete. Actually, I will just go through that first. So it all links together. So these are the questions that providers are asked to complete each day. So each day the number is reset to 0 at midnight. So they're expected to complete this every single day. And the questions are quite self-explanatory. They're around suspected and confirmed COVID-19 cases. So whether or not they've had a test, they will still be required to be inputted into the system. And in terms of the outbreak, so we've had a couple of conversations recently around what constitutes an outbreak. 2 suspected or 2 confirmed COVID-19 cases is an outbreak. So it could be 1 suspected, 1 confirmed as well, but it's got a total 2. On the same token, Public Health England do require care homes to advise either the local authority or the system if there is even 1 suspected or confirmed case. That is known as an incident. So for the purposes of an outbreak, which is what we're kind of calculating the capacity tracker, is 2. But if care homes do have even 1, they are expected to escalate that outside of capacity tracker to their Public Health England and local authority and CCG colleagues. So these are the questions that we expect care homes to complete each day. There's a residence question, and then there's a staff question. The staff are all staff who are employed by the care home. Doesn't include agency staff, but it's all staff employed by the care home, including non-clinical staff. So if there is a manager, for example, that has been care home manager that has been going on site that is tested positive for COVID, they also need to be included in there. So the report looks like this. So it's all the questions there. And here we go. So the total COVID-19 resident count, you'll be able to see yours for your local area. Like I say, I can see quite a few. Are the total residents in London who, for my screen, who currently are either suspected or confirmed to have COVID-19. It is quite self-explanatory in terms of symptomatic and confirmed staff and residents. And it is calculated as an infection rate. Could I just ask everybody to mute themselves again? Thank you. It's calculated as an infection rate. You can look at the last 24 hours. So one of the questions we had was the total doesn't necessarily match. So we're not seeing all the care homes. It's because the 735 homes in London updated the capacity tracker in the last 24 hours out of 1,349. So if you move across to all results, that should cover all the ones that have. There are some out of scope, so the number looks slightly different. So for your area, so if you look at Northwest London, for example, 178 have completed it in the last 48 hours, and 147 have completed in the last 24 hours. Just a reminder, it resets at 12 o'clock midnight every day. So that's when the expectation is after that point to update. Separately, we have a outbreak monitoring report. So again, we'll just pick on an STP.
Hassan, I might just jump in because there's a question from Catherine.
Yeah.
Logan, why doesn't total, I think we've had this question before actually, about the total residents, it doesn't equal the residents confirmed and residents symptomatic.
Yeah, I think that's a bug that we've had since we've updated the system, especially because of out of scope homes and the CQC update that we've had recently. So that's something we're working on, and it has been flagged, and we'll continue to check it. Frustratingly, some people do have the right number and some people don't. So I know myself and Chris had a different number yesterday. It is a bug, and it has been picked up. I'm just going to use a slightly different STP for this one, just so we don't have information. So here you're able to see when your outbreak started and the last known case of COVID-19. So, for example, the second care home here updated this morning that they still have an active case of COVID-19. So they've had COVID-19 outbreak lasting 7 days. And it's staff and residents, and that's confirmed and suspected. It's quite self-explanatory. What you can do, even though obviously the COVID-19 reporting started recently, you can pick a specific date range. So if you wanted to do yesterday and today, these are the homes that have reported that they've got an outbreak. It is defaulted to care homes, so if you do want to use look at information for a hospice, you do have to click on that separately, and you can, as we go forward and we have more data, you can look at ongoing and recovered as well. And you can look for specific care homes in this outbreak monitoring report as well. So that's the outbreak monitoring report.
Hassan, can I just, I think there's a question from the hands up from Anil, I think.
Yeah.
Is it Anil Nair? Anil, do you want to?
My question was, for the outbreak monitoring report, does where a home has got 2 or more, does it automatically flash it up that's an outbreak? Because I have one care home in our area where we've got 2 suspected COVID, but when I ran the outbreak report, it didn't show up. That home didn't show up on that report.
Okay, so there is an algorithm kind of sitting behind the questions that does calculate outbreaks. That it should come up. Could you contact me specifically with that case, and we can look into it?
Yeah.
Can I just ask? Yeah. Was it 2 in one day? Because it's 2 in 1 day, I think.
I think it's 2 in 14 days.
Oh, is it? Sorry, apologies. Yeah.
Okay. So an outbreak is classed as 2 suspected or confirmed within the last 14 days. So that's what it should come up as. If it doesn't, could you let us know, Neil, or anybody else that's having a similar issue?
Right. Okay.
So as soon as the idea behind it is whenever they update on a daily basis, there is an algorithm in the background that's kind of assessing whether or not there's still an active outbreak. Is it, Sanjit, do you want to take questions on COVID-19 reporting, or shall I move on and then take questions at the end?
Yeah, there's a couple of questions in the chat box around what does the ongoing status mean? I think that's going back to the COVID-19 status reports. What does ongoing status mean?
Where are we looking?
I think that was from Anchor.
Hi there. You had something about ongoing status when you were showing the number of confirmed or suspected residents or staff.
Okay. So the idea behind ongoing and recovered is again, because the information has only been updated for a couple of days, we're not really going to see that right now. But in about a month, 2 months' time, you'll be able to see if there are active COVID-19 cases in a care home, or if that care home did have COVID-19 cases but has now recovered. So you'll be able to toggle recovered care homes and ongoing cases of COVID-19 in care homes.
Thank you.
Okay.
Thanks, Hassan. Just a couple more questions, just around provider compliance and PPE reporting. I think we're going to cover that in the next 10 minutes already. So, and there's another question around if you're already registered on the tracker as a local authority employee before you became a champion, is your account automatically upgraded? I think that goes back to what you were saying. If you're not a system,
we can provide the rights, but that are appropriate for that account. So if you just get in touch with your STP lead or your local system champion, they'll be able to escalate that to us. But yeah, we can give you the rights as long as you've given a correct reason for why you need those specific rights.
Okay, great. Thanks, Hassan.
No problem. So we'll move on to update reporting. So this looks a bit different this week. So we'll just run through what this looks like. So this is an update summary. So here, what we're looking at is how many homes and the percentage of homes that have updated their information on Capacity Tracker in a given period of time. So I've gone to STP level, so these are the STPs that are showing for London, and you can toggle between whether they're updating the information for their vacancies, so the number of beds that they have filled or empty, business continuity, which I will go through in terms of a provider perspective, what they need to complete, or both of them. Have they completed both? And then you can specifically choose care home, community, acute, and hospice. So again, the information will look exactly the same no matter what you toggle. You can pick multiple. The information that we've kind of been focusing on is the number of unregistered homes. So we've been specifically contacting through the contact centre to try and get these homes registered. Then there are the homes that are never updated. So they've registered for the system but have never updated their business continuity or vacancy information. And then separately, we've got 24 hours, 48 hours, 72 hours, 7 days, or anything longer than 7 days. Just to reiterate, the ask is the capacity tracker needs to be updated every single day. So 24 hours is what is the number we should be looking for. And actually, this number has gone up quite dramatically over the last couple of weeks for London. We were much lower. So it is increasing, but we're still lower than what we would hope to have in London. And as a region, we're actually lagging behind some of the other regions, and that's been highlighted at a national level as well. So the focus should be 24 hours, all care homes updating. Once we have the unregistered, the contact centre have been contacting the unregistered homes. They have also been contacting the never updated homes. So understand if there's any barriers around that. So this report is actually one of the most crucial ones in Capacity Tracker to understand who we need to contact. If you look within each STP and click within each STP, it will tell you the care home and when they last updated. So these are the ones that get a sticker and a pat on the back because they've been completed in 24 hours. If you want to contact a care home that has never updated, there has been an additional button added recently. I don't know if you can read the pop-up. It says email this location to request an update. So that button will automatically send an update to the email address that's registered with that account. What we are finding, and Chris thankfully highlighted this, is some of the email addresses don't actually work because they've registered with the wrong email address. Unfortunately, we can't amend that. That has to be the care home that's gone in, so they can amend that care home. So their email address. So again, if you are getting that response, we're going to have to do some digging around contacting the care home and asking them to change their email address. But that's a really helpful button to just kind of prompt them a little bit.
Hi Hassan, it's Lucy McCulloch from Southwest London. Just quickly on that point, when you click the request update, it opens up an email in your Outlook, doesn't it? And then you can tweak the message.
I'm going to look at you a bit blankly, Lucy, because I actually haven't dared to press that button yet.
So Hassan,
Well,
it used to do that. It used to open up an email. My experience since this feature's been restored the last few days is that you click it and it kind of does something, but it doesn't open up an email. So my assumption is that it sent it when you clicked it, but it doesn't actually tell you it has. So it doesn't do an email anymore, but I don't know what it does do. We'll look into it and get back to you, I think.
Yeah,
Okay. And then can you just tell us how we tell our care homes where to change their email address, please?
Yes. I'll have to quickly go through a. Let me have a look. Actually, I did set up. Yeah, so when they kind of go into their home to set it up, this is what it will look like for them. They can amend their email address here. So it's but again, kind of System Champions, you won't be able to see this, but it's fairly straightforward. Is that okay, Lucy?
Yeah, that's great. So they go to their provider
details,
and they go to the contact directory. Okay.
Yeah.
Thank you.
Yeah. If you're having any issues, just give us a just drop us a line. Otherwise, the contact centre are really good as well. So if you ring through the contact centre, if a care home specifically is finding it quite challenging, they've been very good at kind of talking through them at a pace that helps them. So in terms of the update overview, we also have a new report, which is update consistency. So this report, it didn't work for me just before I came on, so I'm hoping it, yeah. So this report allows you to see at your CCG level, your homes that have completed the business continuity and vacancy updates on that particular day. So for example, Abbey Ravenscroft Park updated on the 4th and 5th of June, but didn't on the 6th and 7th. So it just gives you a much more intimate view into what the care home has been doing in terms of their vacancy update history. Again, you can pick a date range, and you can it again is defaulted to care home, but you can click community, acute, and hospice as well. So fairly self-explanatory, and you can go back 7 days and forward 7 days, and you can. Sorry, the other thing to mention again with all these reporting, they have a CSV export. So this is kind of, it'll give you the information in an Excel format. The one thing to note is that the report might look slightly different, and especially with the percentages, you might just have to change the formatting for the cells to change it into a percentage, but that will give you that information to export. Sanjeet, is there anything on the chat around the report? So shall I move on?
Chris, was there anything that was relating to the reporting section?
So yeah, we had one. Do you know where the CQC is sharing data regarding deaths? Personally, I don't, but we can look into it and get back to people.
Yeah.
I actually have a statement that I copied onto my OneNote for this particular reason. So there you go. There are no plans. So the CQC have provided information on deaths. That's where the information goes. And they hold that information. So the response I've had is there are no plans to pull this information into the capacity tracker. However, NHS England are developing a dashboard which may pull this information through. Longer term data sharing is being discussed currently, so they would never say never, but in the short term, this information is not being shared outside the existing reporting channels. I know our one of our business information analysts, the BI analyst, is having a conversation with CQC on Monday, but there is no plan currently to have information around deaths in CQC. We had this previously on the national Q&A, and the suggestion was to contact your local CQC representative to get that information if you need it. that okay?
Thanks, Hassan.
So this is a utilization report. So we came into vacancy oversight and then utilization report. And again, this tells us, so this is predominantly for the people contacting care homes and wanting to understand the capacity available. So we discussed recently about how we involve acute providers as well. So this is the kind of information that would be really useful. So we've got the bed type on the left hand side. So I've kind of gone to an STP. So this is the bed type that we have available in that STP. The number of vacancies compared to the total capacity, and the occupancy within the total capacity, which is given an occupancy rate. Most people will never have seen an occupancy rate this low, and that's due to COVID-19. And there's a bit of discussion around kind of what that will look like going forward. Separately, if there is an acute provider, a hospital, a trust that's looking at care homes within that area, that can provide for their patient and they wanted to discharge, they would use a separate field which is around finding care home vacancies, community vacancies, and hospice vacancies, which will then pull in this information. And then lastly, we had a group of questions at the end of last month, at the end of May, which was around ASC Infection Control Fund. So there's a £600 million fund which is linked to these questions, which will be disseminated out to local authorities and care homes. So there's a return that kind of gives us information as to the number of care homes that have completed and how they've completed. There's a separate there's a return, and then there's a details button which can also be accessed from here, and then there's a chart as well. Sanjeet, correct me if I'm wrong, but I think there is another deadline to make sure that all care homes have completed at the end of this month. Is that right? At the end of next week?
Well, I think it's 26th of June. It's for local authorities to send their first another return. So we really want, I mean, it's 18th of June. So I think there are still a fair few care homes in the London region that haven't completed the questions on capacity tracker. So I would urge system champions, particularly local authority system champions, to get in touch with those care homes, because you can pull that report off capacity tracker about where there's gaps.
Yeah. You can get more detailed responses here as well. So you can go to your specific CCG and find out which care home has completed it and how they've completed it. There are discussions ongoing around whether these sets of questions will continue to be on the system and whether they will need updating. That conversation is happening at a national level, but at the moment, this is a point in time. They may potentially require updating in the future, or they might completely come off the capacity tracker. That will be dependent on national conversations and what the ministers decide. So, and again, there's a CSV export in there if you want to understand kind of information. The one thing that we have highlighted to the central team in terms of development is to whether or not we can have a field in the CSV export around when the information was inputted. Again, because this was meant to be a point in time, that was never considered, a key component of the reporting. But if there is a requirement for it to be updated regularly, then that will be something that will be inputted. For now, you can go back in time to understand what the situation was in your local area. So they are all the reports that we were planning to go through. Does anybody have any specific questions around reporting or any specific reports that they would like us to go through that we've missed?
Hassan, I think Anil's had his hand up for a while.
Yeah, sorry, I've just run the update consistency report, and then I look at the vacancy update, and there's two different numbers. So if you look at the consistency report, it says 24 care homes have updated as of today, but when I looked at the update summary report, 29 care homes have updated. So do you know why there could possibly be a discrepancy?
Not sure. It might be to do with vacancies, business continuity, and both. Stuart, do you have an idea on what that might be, or is it something we have to take away?
Sorry, just repeat that. What was the question? Sorry.
So on the update consistency, when I just ran it for Hounslow, it said 24 care homes have updated as of today. But when I looked at the update vacancy list, 29 care homes have updated in the last 24 hours.
Right, okay. And that probably is something that we do need to take away to actually look at.
Yeah.
So,
Now, in the last 24 hours, does that include obviously anybody that updated 135 yesterday as well? That
Yeah, I've got a feeling that might be the case, unfortunately. But that's a question that's probably myself and Stu can answer. Could you send that to us and we can look into it and see if there is an issue?
Hassan,
okay.
thanks, Anil. Hassan, there's a question around PPE reporting.
Yes. Okay.
If you could just give us a quick demo of the PPE report, seeing that's available.
Yeah, I'll go through the workforce as well, actually.
Yeah, and the charts, if we've got time. I think we've got about 5 minutes.
Okay. My system's crashed a little bit. Can you see this okay? Right. So we've got some of the issues we've been having, and we'll come on to it, is around workforce and PPE reporting. We've got to remember that RAG status is subjective while data isn't. So that's something that we've had issues with. I'm going to try and, I don't know if I'm just going blind, but I can't find the PPE. Help, Chris.
It should be under business continuity. If you if you look at status summary table, that will have all of it on there. Yeah,
got it.
And select.
Went a bit blind. Too much talking. Right. So, like I say, the main issue we've been having recently is around RAG status, and some areas kind of saying that they don't have any issues with PPE, but still kind of highlighting themselves as red. Unfortunately, that's a bit of a training issue at the moment. So the idea behind the RAG status is, I don't know if you can see the drop downs, but there is a bit of guidance around what green means, operating with minimal or no risks, and red is no supplies available at the location or will run out within 14 days. So the idea behind this is local authorities and CCGs can assess the situation in each care home. There is some information. So if you go to help, there is some more information in there around in the resource centre around what the RAG status means and what care homes should be including. But again, there is a training issue around asking care homes to ensure that they're not just RAG rating themselves as red because they want to raise a concern. In terms of does that cover it, or do we need to go into a bit more information?
So, Hassan, we had a question asking what the red, amber, green means. So, just to reiterate that red is fewer than 2 days supply, green is amber is more than 2 days but less than a week, and green is more than that. And as you can see, you can put if you put your mouse over one of the rags, then it tells you what it means.
Like I said, there is some guidance in there around in the user guide as well, so we will share that with you, and that has some quite clear advice in there, but it can be accessed in the resource centre as well.
Thanks, Hassan. Can you just quickly show the system champions where the charts that you can see some of the trends over the last few weeks? I think that would be useful just to.
Which charts would you like? Shall I quickly show the COVID-19?
I would probably any of the PPE charts or workforce or any really as an example of what's available.
Oh, bear with me. So this is one of the COVID-19 charts that we'll be able to see. Right, you're going to have to help me again, Chris. I've gone blind.
What you have to...
Charts.
So it should be under business continuity.
Yeah, I thought it was, but I can't see it.
And then you've got the map, or you've got... Is that what you wanted, the map that showed various bits, or?
I'm not entirely sure, if I'm honest.
I think it's a COVID-19 chart.
Okay, the COVID-19 chart.
Yeah,
okay,
so it's not.
Yeah, fine. So yeah, this looks slightly different, and it will look slightly different as we go forward because the dates are going back in time. So what I would suggest is the information would started last Thursday, if I'm not mistaken. So it's worth just going to that date for an accurate representation. The rest of it was the charts don't work so well on Teams. Let's see if I change that. There we go. So this will give you a representation of your STP. So you can either choose one STP, or it's every STP will be represented, or you can go for CCG. Some areas, we had an issue last week, at the end of last week, where some homes had inputted, because of kind of some confusion around the box, 1,111 incidences of COVID-19 infections. So there was like a 1,000,000% COVID-19 infection rate. That's been remedied now, but if somebody does find an issue in your local area, can you let us know quite quickly so the contact centre can amend that? But that's something that we did find. So there is some validation that's gone on, so you can input any information that's a number that's higher than the occupancy rate that you have. So if somebody does run these charts and there is a huge spike from last week, that's why. But this is what the chart will look like. Some areas are kind of down here.
Ooh, thanks, Hassan. Just conscious of time, can we just move on to the next item around provider views?
Yeah. So the one thing that kind of we had a question on in terms of the Q&A, the national one today, was around how care homes are updating the business continuity and vacancy information. So when kind of providers go into this section, whatever they are, care home or a community provider, etc., they're kind of confronted with this screen, which has all the information that they need to complete on one screen. So this is what it would look like for one care home. So this is one care home. They have an indicative price in terms of a bed. Again, this is an indicative price. I know some care homes are quite reticent to include this information, but it's just a suggestion. So when somebody gets into contact, whether that be a social worker or a trust, they would then discuss the price. It's not kind of fixed. There have been a couple of requests for broker access as well. So this is if there is a brokerage in your local area, the brokerage can update information for multiple care homes in one go. The one thing we do kind of stress is the broker does need to contact the care home on a daily basis to understand that the information is accurate and whether or not it has changed. It becomes even more important now that we have the Public Health England COVID-19 ask. And this is the way that Public Health England are monitoring outbreaks. So if there is brokerage access provided, can we make sure that the broker is getting into contact with a care home every day? Or if it's a care home provider that has multiple care homes, there's some large providers across the country, we do ask if they do have access to updating their care home information, they are getting into contact with care homes, and they're not just doing it as a tick box exercise to say, yes, we have updated. So coming back to the RAG status that we mentioned earlier, we have RAG status here, and each RAG status does have some information above it to provide an understanding around what it means. Again, it is subjective. Care homes do provide subjective information around what their RAG status is. In terms of PPE, again, as Chris mentioned, green is no issues, amber is expected to run out within 7 days, and red is expected to run out within 48 hours. And we have aprons, eye protection, gloves, surgical masks, and hand sanitizer. In terms of the COVID-19 questions, we mentioned it earlier, the red boxes are the ones that need to be completed. We did have a question around these two questions and this one at the bottom. They're automatically calculated, as Anil mentioned. These ones will kind of auto-populate from what is inputted here. Again, the query we had, the issue we had with really huge numbers being inputted was because this box wasn't big enough. So they couldn't see kind of when they inputted the number in there that it was being inputted. So they were, putting 1,111 or 222. So again, they split into residents. So number of residents with COVID-19, any new, so they're anybody that's got suspected COVID-19 or confirmed, any new cases that day, and then any residents that were admitted from outside the care home. We have had a query that this question, the fourth question, isn't coming up in the reporting. So we have escalated that as well. So bottom two auto-populated, and then the same with staff, newly suspected, newly confirmed, anybody that works in the care home that's not agency, that is employed by the care home, whether they be clinical or non-clinical staff. In terms of the workforce, we have specific questions around nurses, care providing staff, and non-care providing staff. So how many FTEs there are? It is a full-time equivalent as well that is being asked at the moment. Who's absent, and then what the requirement is at the moment in terms of nurses, care providing staff, and non-care providing staff. Again, if you hover over the RAG status, it'll tell you what the RAG status means. The difference between the PP and the workforce RAG status is the PPE RAG status is a bit more objective. It tells you, gives you specific days for the amount of PPE they have. Here, it says operating within agreed staffing ratio, have a significant escalation risk in coming days, and then and workforce level ratios breached, business continuity in place. But again, some people might feel a significant escalation might be subjective to that area. So that's why, again, just a bit of a conversation with care homes. These are the AC infection questions that we had. Again, request to complete them as soon as possible, even if they haven't been to date. And that's all the information in one go. It's very, very quick. They can access this on their phone. It comes up on the phone in quite a good format as well. So they can input it in no more than a couple of minutes. And if they've completed this, then this is all the information that they need to complete, and that's all they have.
Thanks, Hassan. Just conscious that we've only got 12 minutes, and I know that there are a few system champions who would like to see, from a community health provider perspective, which I think is a bit more straightforward. If we could just
sorry, can you just show how you save that? Because I had a couple of care homes say they filled it in, but they don't know how to save it. Where's it? Do you have to scroll all the way down?
Yeah, I don't think I can actually do this because I'm not a care home user. I think I can just see. Stu, I can't. That save button doesn't come up for me here, does it?
The save? No, not at the minute, unless you impersonate a care home.
Right, okay.
Do you want me to impersonate a care home quickly?
Oh, there we go. It looks very similar to this, doesn't it, Stu?
Yes.
Yeah. Okay, so it's right at the bottom of the screen.
Right at the bottom of the screen.
Yeah. Okay. Most pages, it's right at the bottom. Although we're looking to try and relocate it somewhere more prominent, really.
Okay.
I think what might be happening is because they've completed the infection prevention information, they're not scrolling to that bit and they're not getting the save details. So they have to, unfortunately, scroll right down to the bottom once they've completed the sections.
Thank you. Okay. And just on the questions, the COVID questions, and there's the language there. It talks about today, number of residents today. Now, obviously that's subjective because it depends what time they go on. Should it be something more like since you last updated or in the last 24 hours or?
I think this might be one of those things that we don't really have much control over. I I don't know how you feel about that, Sanjeet, but I think this is I think there was a lot of conversations around what these questions would say at a national level, and it's a Public Health England ask, as far as I understand.
Yeah, and we'll go back and clarify that. So we'll make a note of that.
Thank you. It just kind of hit me like, oh, I'm not really sure they would get that today, business.
No, that's really helpful, actually. That's and it should be. I think 24 hours might be useful because that is the ask as well. Yeah, and they might be doing it on an evening. They might be doing it first thing in the morning. Yeah.
Thanks, Hassan. Just conscious about the community health. Yeah.
Again, I'm not sure if I can. Yeah, I can.
But if people would like a bit more detail around the community health side, I think it's a bit more straightforward than the care homes one. We're happy to, via your SDP links and system, via your SDP leads, to arrange a time to talk you through the community health or hospice side a bit more, if needed.
Stu, is this something I'm going to have to impersonate a user for?
Yeah.
Yeah. Could you take over?
Yeah, okay. Just give me 1 second. So what do you want to see again? Sorry, please.
I think it's what the community providers need to update.
Yeah.
What their system looks like.
Yeah.
Actually, no, I'll be able to. You'll be able to see it from them registering as well as updating, or just updating.
Updating. It's their view.
Okay. Yeah, just give me 1 second to find a community provider, if that's okay.
Thanks, Stuart.
Okay.
There is a question. Yeah, whilst you're sharing your screen, there was a question around the grant eligibility for the infection control funds that's been raised. I just wanted to clarify that for accessing the funding that's available, care home providers will need to update capacity tracker. To the grant, the eligibility is on condition that the capacity tracker is completed for those questions. And I think we've mentioned about the 26th of June cut-off period as well. So those outstanding care homes have yet to submit their questions. If they could do that before then, that would be great.
It's Lucy again. I think we missed that at the start, Sanjeet, and you said you put it in the chat, what you actually said, so that would be useful.
Yeah, so I think on the beginning, just any questions around the infection control, the 5 areas, the specific queries around the questions, we probably won't be able to answer on this session because they've all been nationally agreed, but we can escalate it to the national team. But one question that has been raised is around capacity tracker, because I think in some areas of London, market insight tool has been used to complete the questions, and we raised that with the national team, and they've made it clear that it's capacity tracker that needs to be used to submit those questions for care home providers.
And that deadline's the 26th of June, is that right?
Yeah, so in the guide, for local authorities are going to be doing their next return on the 26th of June. So to be eligible for the first tranche of funding, care homes are being asked to, for those that haven't yet submitted, they need to be submitting those questions as soon as possible. I think the 26th is next Friday. So I think Stuart might be having some problems sharing his screen. Is that?
Yeah, I was just finding a user to impersonate.
Okay.
So sorry, just 1 second.
That's okay. Hassan, do you want to just talk about next steps?
Yes. So we'll share a couple of the things that we mentioned. There are ongoing conversations around, as Sanjeet mentioned, around the national team around capacity tracker developments, and a lot of these things kind of come from Public Health England or ministers. At the moment, there isn't any expected additions to capacity tracker. the COVID-19 questions are the biggest emphasis at the moment. We will share the System Champion user guide with colleagues. It is still in a draft format, but I think it's pretty much there, and that will hopefully give some guidance. If there are any kind of accounts that need amending in terms of access rights, and please let us know. And then lastly, there is a masterclass tomorrow that we'll be holding for care home providers only. So the idea with that is there are some care home providers that are struggling with either registering or updating or have questions about COVID-19. So if you can encourage your care homes to join our masterclass tomorrow, and we'll try and kind of answer any questions and go through some of the hurdles that they're going through at the moment.
Hassan, can you send me the email that I can forward to the care homes for the invite?
Yeah, I think
yes.
that it's been done already via Becky. I don't know if Becky's still on the call, or my colleague Helen. But we'll make sure that gets to you because you're part of Northwest London.
Thanks.
Okay, I can quickly share my screen if that helps.
Yes, please.
Just while I'm finding it, just to let you know about that request update. The reason why, Chris, nothing happens is probably you're the same as me. It wasn't happening with me. Is that your pop-ups are blocked on your settings? But if you amend that setting, you'll then get a pop-up in order to actually see.
Thanks, Stuart. That's interesting.
Okay, so someone's working on some sort of guidance on that in order to try and assist and get out to people. So hopefully that will be coming soon, shortly. So can everyone see my screen?
No.
No?
It's working, Stuart, not to worry. I think we've only got a few minutes left. So, actually, it's working now, Stuart. So as soon as I said that, it started.
Right, okay. So in terms of their updating then, so they would then go in this element, the old school way. So in setup, they'd have the 4 steps that they go through. And then in the vacancies, they would just go to vacancies tab. And they'd either review that number. If it was correct, they'd hit the green button to save. It would then date stamp it. They can also indicate whether that actual bed type is a flexible bed type that could be considered for anything else by ticking that checkbox. So that's the update element of it. Is that okay? Any questions from anyone on that?
Don't think so. Thank you, Stuart.
So quite a simple one that can be done either via your laptop, via your PC, via your phone, your tablet, on the go, really. Thank you.
Thanks, Stuart. We've only got 2 minutes. I'm conscious that there's lots of questions that have come through the chat box. Just to reassure you that we made a log of every question and we will respond to you after the session. Hassan, is there anything you wanted to add at the end? Or Chris, is there any burning questions that you've spotted on the chat box?
I think it would just be helpful if we could show where so if you go on the help bit, where the user guides are, and also where the resource center is. I think that's easier to do visually than afterwards, but we'll take other questions offline, obviously.
Thanks, Chris. Hassan, was there anything you wanted to add?
Just in terms of the support that's available, in terms of the contact center, if you go on the resource center, it will also have the information in terms of a number in there as well, and email address. Otherwise, you can go through your STP leads and we'll try and fix anything that we possibly can.
Okay, thanks, Hassan. So it's 2 o'clock. So I'm going to draw the session to a close. Just want to say thank you for all of you for joining this session. I hope you found it useful. Please use your STP leads if you have any further queries. As a region, we're also here on hand for support too. Any technical queries, you can direct them to Next CSU. I think you'll find their number in the resource page. So thank you and all have a good afternoon. Take care. Bye.
Thank you, everyone. Bye-bye.
Thank you, everybody.